Hello and welcome back to Touring the Hudson Valley. I am here with a very, very special guest. We want to get down to the nitty-gritty of this business. I'm excited. Today we are at Yonkers Avenue, okay? Yonkers, my old stomping grounds, okay, with Dr. Hilario. Welcome and thank you.
Thank you for having me. I appreciate you reaching out and getting us on
board. Let's do it. I'm excited. I like to start off these interviews. I want to make sure that the guest knows who you are, how you started, what are we trying to build here. So if you could just give us a little background on your story and how we ended up here.
I've been practicing chiropractic for about 21 years now. It's been an amazing ride. What I do mostly is focus on musculoskeletal problems. So like your neck pain, your back pain, your shoulder pain. A lot of patients will get tingling, numbness, shooting pain, that kind of stuff, headaches. Those are other things that we treat as well. We've been doing it for a long time. We integrate chiropractic. We integrate a lot of different techniques like decompression, acupuncture, soft tissue instrumentation. We've been doing this for a minute. We have a big team. We have a great team. If anybody wants to look us up, we have some reviews online too. So
excellent. Okay, I'm gonna be honest with you here. Okay, I don't have kids running around talking about wanting to be a chiropractor. So how did you get into this field, right? When people say doctor, typically it's general medicine, things like that, surgeon or whatever. What led you specifically to become, in this rehabilitation space?
As a Latino, I don't think we really integrate chiropractic a lot, but unless you're in a country where they use hueseros, which is something similar, I guess, to some degree. But I wanted to go to medical school and I was shadowing different types of doctors, medical doctors, dentists, podiatrists, psychiatrists when I was in undergrad, and I was pre-med, and I had the opportunity to meet a chiropractor and shadow him, and I loved it. The rest is history.
The rest is history, yes. You've got into the space, you must have fallen in love with it and everything, obviously, the process. How was that like speaking to a young entrepreneur here where, there's schooling involved? I mean, you're running a pretty efficient office here, pretty efficient business. Can you speak a little bit on that? The school thing that you went through, that, what the process is like, and then kind of going on your own from there?
So it's a little challenging. You have your 4 years of undergrad, your pre-med, and then you go to chiropractic college where you do another 4 years. A lot of schools will kind of condense 3 semesters in a year, so you do 10 trimesters. It takes about 3.5 years in most schools, which is equivalent to additional 4 years. And then there's the experience. The things that I love the most about chiropractic care is that most of the work is done with our hands, right? I've gotten the opportunity to do mission work in different countries and just bring a chiropractic table and just help people. So that's pretty cool. It's not like a surgeon, for example, who needs a hospital.
Right.
Yeah. So.
I never thought of that. You're 100% right. My wife is very into the health space. She goes to a chiropractor as well and all that. And she's pushing me to go. And you hear chiropractor, you hear spine, and the first thing that comes to mind to me is, what am I, 65? Like, well, that's crazy. What are the health benefits? Why should somebody who's in their 30s or 20s even start looking into this? Why now, so to say, for the younger people?
We treat infants, we treat children. Yeah. I've always treated my children, yeah. So you want to consider, 2 things. One, your nervous system, right? So you have your brain, your spinal cord, and your spinal cord is protected by your spine. So the bones, the vertebrae, and your spine. If you have some type of trauma, that's going to affect the spine. If you fall, even the birthing process is traumatic to the body of the infant.
Pregnancy?
Yeah, they don't just fall out. Sometimes they're yanked out, and it could be, pretty traumatic. And then, kids are always falling and having those type of injuries, and posture affects them over time as well. And they say 80% of the population deals with back pain at one point or another. So, a lot of us have pain, and we just assume it's normal, and it's not normal. Pain is your body screaming for help. It's something you want to address as soon as possible, because if you ignore it long enough, you get to the point where you may need some more aggressive form of treatment, like a surgery. So if you've dealt with back pain, shoulder pain, neck pain, if you wake up feeling stiffness in your back, if you sit for a long time and you're developing pain, if you felt tingling or numbness or even shooting pain down your legs, that's an indication that the nerves are being compressed there. And there's been studies that found that when there's pinched nerve, there's organ damage too, because your nervous system controls everything, right? So you have, again, your brain, your spinal cord, the nerves that branch out. They go to your heart. They go to your digestive system. They go to your reproductive system. They go to different parts of your body. So when there's pressure on those nerves, it'll affect the function of the organs where they go to as well.
Wow. So should someone I mean, as you said, right, the body is the indicator, the pain starts to indicate, something's going on. If I want to prevent future headaches down the road, what would you recommend?
Just about everybody should integrate chiropractic care at one point or another, just because we have repetitive jobs where we're doing the same thing. We have our cell phones now. Everybody's looking down and all twisted. If you've noticed that your posture's a little bit off, your shoulders are going forward, you have a little hump in your upper back, or you develop any type of pain, go see a chiropractor. It's very safe. It's effective. It takes a little bit of time. It's like kind of physical therapy where you have to rehab the body little by little, but it's pretty safe. I would encourage everybody, if you're an athlete, if you have a blue-collar job, if you sit for work and you're spending 8 hours, 6 hours sitting down, that's going to affect your body and you're going to feel it.
That's scary because I'm constantly sitting. And, to your point before, I think, and I don't know if it's a man thing where I'm really not hurting that bad, or it's not really that bad, that may potentially be ruining me down the road.
Yes.
That's scary.
So you get one body, right? You can't just a lot of times we could do some types of surgeries or treatments, but when it comes to the spine, it's not something you can replace easily, right? You definitely want to take care of your body. And usually what happens is that there's structural changes or imbalances in the muscle, issues with the spine first, and then the pain comes later because your body's getting to the point where it's like, okay, there's something here that we need to address, and now it starts screaming at you. So by the time you feel pain, you're already behind the 8 ball there. So
oh, God, don't tell me that.
The more you ignore it, the more complicated it gets over time. There are literally structural changes that happen in your body. It could take 10 years before you've developed significant amount of arthritis, stenosis, where it's pinching the nerves. But once you're there, you can't undo that. So as soon as you start feeling pain, something's wrong and you want to address it.
Well, good to know. That's good to know for me, for sure. I'm going to definitely be scheduling an appointment here. Needless to say. So obviously, right, there's the chiropractor work. I want to talk a little bit about the other things that you offer here, because it's not just, yes, we specialize in the spine, but there's other stuff that you offer. Can you talk a little bit about that?
We spend some time educating the patients on what exercises they can integrate, because we want to correct the curvatures in the spine. We want to strengthen your body. We want to address the weaknesses. We'll integrate stretching, we'll integrate muscle work, we'll integrate acupuncture. All of these different techniques will help you not just correct the cause of the problem, but prevent it from coming back. That's what we try to focus on. We don't want to just treat your pain. We want to correct the cause of the problem so it doesn't come back and you're not dealing with this for years and then you're not addressing it with something more aggressive later on.
Yeah, so we're addressing the actual core of the problem so that you don't come back as a patient down the road. Right. Fantastic. You touched a little bit about, I think you do acupuncture as well. Yeah. Again, listen, I'm a novice in this. I believe maybe a scam of some sort. I don't know. Don't shoot me. Can you explain a little bit about that? Because I really don't know much about it other than a lot of the athletes kind of, do it for recuperation or whatever for their bodies.
Yeah, so acupuncture is amazing. I've heard all the miracles, with chiropractic and acupuncture. People who couldn't conceive and now they're able to conceive. We don't go, we because your nervous system controls everything again, right? We remove that pressure off of your nervous system and it's able to function the way it's supposed to. It's not something that we go around saying, hey, we correct this, but sometimes a lot of issues that you're dealing with are eliminated because now your nervous system is functioning the way it's supposed to. Also, imagine if you have these big knots in your muscles and you're getting pain in your neck and your shoulder, your upper back. What the needle does sometimes, it helps to break up that cycle of spasm in the muscle. So you could be dealing with pain for weeks, months, years even, and getting acupuncture will help eliminate that very quickly. It's very effective.
So how do you diagnose a somebody who needs chiropractic help versus acupuncture? Is there a pre-screening, I guess, that happens, or what?
When it comes to like chiropractic, acupuncture, massage, physical therapy, they all kind of dance together, right? Because we're all treating the same type of issues. When you're able to integrate them all together, you get the best results, right? So the chiropractic, we're restoring motion to the spine. The acupuncture, we're breaking up that tightness. The physical therapy, we're strengthening the body. When you're able to integrate them all together, you're going to get the very best results in the shortest amount of time.
Do you think someone's, what they eat, does that have a role or a play? Obviously, right, the physical activity, everybody recommends exercise and all that. How much of an impact does food have on a person?
It's huge. Yeah. It's huge because there's, foods that are inflammatory. There's foods that help you build muscle. It's a big part of how we feel. You abuse your body long enough with bad food, you develop diabetes, you develop other issues. That's also an important part, yeah.
Okay.
Yeah.
Now, you've been doing this for 21 years. I'm sure you have seen some cuckoo patients out there or even some cases that like there's so much damage that was done that you can't help. But anything that was just so out of the ordinary.
I've had a lot of patients with like severe arthritis. We'll do x-rays, we'll see the arthritis, and you think, oh man, I don't know if this patient's gonna have any benefit from what we're doing. And I've had patients who gotten to the point where they're pain-free, and I'm sure, you know, they've been able to deal with the pain later on again because the arthritis is there and you can't undo it. So that's why you don't want to wait. But we've been able to get them to a point where they're pain-free. So that's something pretty impressive.
That's huge because I mean, and that's really what, you know, like you said, we can't heal arthritis, but if you can remove the pain, that's as close to being healed as possible. Yeah. That's amazing. Yeah. And you can do that through your program or, you know, your process.
Right. And when it comes to medication too, you want to be careful with that because a lot of times, you know, with the American culture where we want everything fast, we start taking pain medication. There's side effects with that, you know, and some of those side effects include death. You want to be careful. If you've been taking medication for a long time, even the over-the-counter stuff cause ulcers, it can cause a lot of issues where it gets to the point where the damage is you can't undo. So especially men, we like blue-collar workers, everybody really, we want to just keep it going. We have people that are depending on us. We want to just keep working. We start taking medication, but over time, there could be a big price there. So doing something that's a lot more benign, like chiropractic care, physical therapy, massage, acupuncture, is going to not only correct the cause of the problem, but it's not going to have those side effects.
Wow. You know, you touched the base a little bit on it, obviously, right? The whole man thing. And that's, you know, it could be culture. It could be a bunch of different things happening at the same time. I wanted to touch base before we wrap up on an entrepreneur level where obviously you're an entrepreneur, you're a father as well, right? How do you balance that? Because I think just a couple minutes ago, this is your day off and you're out there, you know, you're still working behind this table. So how do you do it? And if you don't do it, that's fine too, right? There is no right or wrong answer here, but I would like to know, how do you balance family time with still trying to grow the business that you have?
I'm blessed because I have a great team. Our front desk, our manager, other chiropractors, acupuncturists, our entire team is amazing. I get treated myself multiple times a week by these guys.
¿Cómo?
Yeah.
That's got to be good if you're going. I mean.
Yeah. So, you know, the secret is to surround yourself with people who are like-minded, care about the patients, and they do a good job. So having a good team is the key.
I love that. I love that. I want you to speak to the young person who's thinking about getting into chiropractic work, who's thinking about getting into physical therapy. One piece of advice that you would say to them directly.
I would say go for it. One of the things you want to do is shadow doctors, chiropractors, physical therapists, whatever you want to do, and see if it's really what you want to do. Because a lot of times you'll be like, I want to do that. And then you see a little bit of the behind the scenes. You're like, wait, I don't really want to do that. You know, for me, it was like, I want to be a medical doctor. And then do I really want to be in, you know, an emergency room type of setting or have people calling me in the middle of the night? And I was like, you know what, chiropractic fits me better. So, you know, shadow different professionals. See if it's really what you want to do and go for it. You know, it is challenging, but everything is challenging in life. Not going to school and working a difficult job for 30, 40 years is challenging. So everything has its challenge. So if it's something you want to do, go ahead.
I love that answer. I honestly do. I think people don't understand, like, you know, when you're young, you don't have money. So you can't go, you know, maybe you don't have money to pay a coach, you can't find a mentor, whatever. You have time though. And the best thing you can do is give your time to these people that are doing what you want to do. So you have the ability to show up, shadow them, help them out, get them a cup of coffee, go run their errands, go get their dry clean. The idea is that you make yourself available and you can see for yourself if that's what you want to do. It's fantastic advice, absolutely fantastic. Okay, I really appreciate you sharing that. If you could let everybody know where you're located, the hours, how does someone set up a consultation via online? Where's the best place to reach you?
So the best way is to call us, but you can look us up. The business is called Chiropractic Rehabilitation Source. I'm Dr. Alex Hilario. We have a great team here. The phone number is 914-584-6864. You can reach us that way. We're in Yonkers, New York, on Yonkers Avenue. We service patients who come from Rockland. We have patients who come from New York City, the Bronx. We're right next to the Bronx here. But yeah, we're in Yonkers. If you're not too far and you want to get some really quality treatment, give us a call.
Excellent. And we'll wrap up with this. So obviously you're running a pretty successful business here, 21 years in the business. You must be doing something right. Where do you see yourself 5, 6, 7 years down the road? Where do you want to take this?
I hope hope to keep practicing. I really love what I do. I think our success comes from the fact that we really care about our patients. We want them to get better. We want to correct the cause of the problem. We want them to have success so that they can go and say, these guys are amazing. And I think we've been able to do that. And I want to be able to continue to do that and serve other people. I mentioned earlier, I've done some mission work. I want to be able to serve the Yonkers community as well and just give back and help people live a pain-free life. Some people are dealing with pain. They don't know that there's treatment out there. They don't, they think that it's just painkillers and dealing with whatever comes with that. Educating people, just giving them some information, it could be life-changing. I myself have had a number of procedures, so I know how difficult it is to deal with pain and have to sit there. Get help if you're dealing with pain and integrate chiropractic if you've never done it. I think you'll be pleasantly surprised.
Get help means come here, okay? 21 years in the business. Clearly he knows what he's doing. People keep coming back. Get in here. I'm gonna make an appointment. Thank you so much, Dr. Hilario, for doing this. You're the man, brother. Really looking forward to the future and what you're looking to do.